cancer. By cancer, they are the cells rapidly growing. And normally cells are at one place in the body and they're doing their task, what they have to do. These cancer cells are not doing that. They are rapidly growing and also spreading, going to other places. They can go, they can invade other tissues, growing over the tissue about to be invasive, having malignancy, then be invasive to besides to other organs, or spread over the lymph and blood vessel system to other places in the human body. And they are a waste of things in the human body, and over time they lead to death if treatment isn't successful. And some other things general about cancer. Every second person statistically gets cancer in their lifetime, and the older the person gets, the more likely is it that they get cancer. Some cancers also have children, like leukemia, cancer of the blood, or cancer of brain or bones. Men and women have cancer overall equally. There are some cancers which women more have or men more have. And also some causes are named here, what cancer can cause. There is said in this book from the 80s, from 1982, that there are some suspicions towards some chemicals, maybe in the food, in the air, and the water. Some people who work with such chemicals might get more likely cancer. And then there's also said cancer is not hereditary. There are some things which make it more likely that some children get it more likely, but it is not hereditary. And there are some viruses which might cause leukemia or neck cancer, but in general, not so much. The main thing is cancer is not infectious. So there are some viruses which can cause cancer, but cancer itself is not infectious. And then we have studied something to the terminology. They said neoplasm, that is just the growth of new cells, which are useless. And tumor is it when it's bigger, to be felt or seen. And carcinoma are the cancers called of the tubes of the gut of the bronchi. And sarcoma are the cancers of the connective tissue, of the muscles, bones, ligaments. And they can have malignancy, that means that they are invasive to other places. And they can be malignant or benign. And malignant means that they are doing that invasive stuff, and benign means they're doing that not. But some benign can turn malign, so they're sometimes removed when they are benign. What symptoms do they cause? A bunch of symptoms. Cancer oftentimes just causes symptoms as soon as it is advanced to be destructive. And there are some general symptoms like loss of appetite, some fatigue, some mood changes, and weight changes, but also some other things like blood or mucus in the feces or in the urine, or other things. And now what can be done against it? Now the first important thing is the earlier the better. The earlier the cancer is found and treatment is started, better. Now what can be done? There's the idea of surgery, then it is just cut it out, maybe then in combination with radio or chemotherapy. So cutting it out, surgical, is an option. Another option is to make a radiotherapy. Cancer cells are more susceptible to X-rays, and therefore they're getting more. And also chemotherapy, where also these medications or whatever they are more infectious, more stronger going onto the cancer cells than on other cells. And how is it found out? They can be made X-rays, they can be swallowed a dye, which is then taken in stronger by the cancerous cells as the other ones, and then it can be seen on the X-rays or something. And other things, they can be made biopsy of the cancer itself, have things taken out and then looked under a microscope under it. And they can be looked into little specks of blood in the feces. They can be made then tests of a cervical smear for cancer at the neck of a womb, or testing the urine, or other things. And this is what your written is. And they are basically ending with advising with if in doubt, find it out. So they're saying the earlier it is found, the better. And if someone is doubting that maybe a mole is turning cancerous or some things or something like that, if in doubt, find it out, do they say. And early finding, screenings, checking for some things regularly might help to find it earlier and to have it earlier. And they're also saying that, and that already in the 1980s, that they are working on treatments and that they're making advantages to be able to cure and treat more and more cancers. So, and that is all according to the Reader's Digest Family Medical Advisor written by Keith Hodkins in the year 1982 on the pages 106, 107, and 108. But this is no substitute for medical knowledge and also no medical advice. Hi and welcome. I'm trying to learn oncology, today cancer, and after we've done it, we're gonna do tiptoe yoga, and if you participate in the tiptoe yoga, then it's at your own risk. The book is written in the 1980s, and this is no medical advice, I'm just trying to read and to understand it. And we read it already in the previous 2 or 3 parts. Now we're going to go off the text again, and we try to puzzle together a little presentation about what was here mentioned or said about cancer. Cancer is not a single disease. It is a process that can affect any organ of the body, and each one will have different symptoms and different prospects for recovery. Cancer is a disorder of cell growth in a part of the body. So cancer is a disorder how the cells are new growing and forming. It can be anywhere at any organ and anywhere in the body, and it has a different prospect depending on where it is growing. The human body is made up of billions of microscopic cells, each with special roles and duties. Normally, each is orderly in growth and reproduction, but in cancer, cells in a part of the body become uncontrolled. They multiply rapidly and look different from normal cells under a microscope. Because of their growth, they form a swelling which may become ulcerated. So normally, cells are just there, and cells are reproducing. They can't live forever, and after some, I don't know, it would be nice to explain. I'm rehearsing it a little bit. And after some time, a cell is just reproducing and a new one comes with. By cancer, there is a problem with it. It doesn't run in order. They're producing way too rapidly. They don't doing their job at all. They're just rapidly producing and growing and swelling and forming a tumor. Is it said here already? Their growth. But by saying on tumor, I think we can say tumor. Tumor is I think wrong, and they say that here in the next one. Tumors. Someday. Okay, and then growing like that. That's the introduction. Normal cells know their place in the body and remain within the limits of the organ of which they form a part. But cancer cells now know such bounds. They invade adjacent tissues and destroy them. Now, I hope when we say it like that, it's not maybe a bit outdated from the 1980s, that viewpoint. I don't know anymore. It just sounds a bit too easy. But I want to mention it. If we have it, we can then find out whether it is maybe outdated. So, and they're not doing their job, and they don't just say that they are just growing and spreading, and they are invading, but also invade adjacent tissue. This excessive growth is not only in nearby tissues. Some cancer cells penetrate the blood and lymph vessels and spread to more distant organs such as the lungs, the liver, bones, and lymph glands. They will establish new cancer colonies. This moving and settling process is called metastasis. The transference of disease from a primary to a secondary part of the body, and the distant colonies are called metastasis. Metastase. I'm not able to pronounce it differently. Metastasis is the process, and metastasas or something is the thing. Okay, they can spread, invading adjacent tissue, but also going into the bloodstream. Blood and lymph vessels, both. I don't know what lymph vessels are. Into the blood and lymph vessels and spread them to other places. And that spreading is called metastasis. And where we then are forming new uncontrolled growings, they are called then metastasis. Establish new cancer colonies. With such hectic, disordered, and uncontrolled cell activity, the body's energies are misused and wasted. If this continues unchecked, it will use up all the body's reserves and result in death. But modern treatment can cure more than 30% of all cancers. And they are just hectically, they're just uncontrolled, growing in the body, misusing it and wasting the energy of it, and leading them to death. But there are more and more treatments against more and more types of cancer. Who is likely to get cancer? Although cancer can occur at any age, the disease tends to become more likely as people grow older. From 40 onwards, the likelihood of getting cancer increases considerably. In any year, 1-3 people In any year, only 3 people in every 1,000 develop the disease at 40, 9 people in every 1,000 at 60, and 18 people in every 1,000 at 80. So in 1 year. These are 20 people in 1 year. That means if a person is for 10 years long in their 80s, these are 200 of 1,000. That would be 1/5. So out of 18 of 1,000, it means 18 in the year of 80, and another 18 of 1,000 in the year of 81. So between the age of 80 and 90, 1/5 of people gets cancer. And it's probably even more increasing to 18, 19, 20. So maybe at the year 89 it is by something high. So what we're basically saying with it here, it's not 18 out of 1,000, but more like every 5th person between 80 and 90. But already between 60 and 70, 10 every year. So there's already 10% between 60 and 70, and 15% between 70 and 80, and another 20% between 80 and 90. So we're already by 40% of people. With other words, maybe they don't, I don't know why they wrote it like that here, but if one calculates the numbers through, it is 40, 50%, maybe more. The reason why aging, so maybe, I think I said it as it's understood, but I just wanted to make it clear what I just said. So I said just, it is not 18 in 1,000 people, but 18 per year of 1,000 people. Which means over the course of the 10 years between 80 and 90, if a person dies not from something else, it is every 5th person. And already was it every 6th person between 70 and 80, and every 8th person or something between 60 and 70, accumulating it all together until a person has reached the age of 90, 50% or something have got cancer. The reason why aging cells are more likely to become cancerous is not yet clear, although current research into the problem could provide a solution in the foreseeable future. Okay, we don't know right now why people who are older or whose cells have aged are more likely to get cancer. The areas of research include the irritation of cells by smoking, harmful chemical reactions from certain foods, the lack of dietary fiber, the overexposure of the skin to sun, especially in hot climates, and adverse reactions from industrial work with such materials as rubber and asbestos. We're naming that in the next, yes, it's the same section again. So we're having here, so what we're saying here is smoking, maybe harmful chemical substances or reactions, also in food. Harmful chemical reactions from certain foods, but I'm pretty sure there are also chemicals existing which just cause cancer without eating, but just exposure. But that's not part of it, you know. So we're saying here maybe one idea what causes this: smoking, harmful chemical reactions in foods, lack of fiber in the food, and overexposure of skin to the sun. These are some ideas which we have. But despite this tendency to affect mainly the middle-aged and elderly, certain cancers such as leukemia and cancer of the brain and bone occasionally develop in children. So some types of cancer, like leukemia, cancer of the blood vessel, or of the brain or bone, are also developing in children. Cancer affects men and women almost equally, although certain organs are likely to be more affected in each sex. For example, breast cancers occur predominantly in women, and lung cancer in men who tend to smoke more than women and who generally start smoking at an earlier age. In Western countries such as Britain and America, 1 in 4 deaths will be from cancer. 1 in 4 deaths, while 2 in 4 will be from heart disease and strokes, and 1 in 4 from other disease. So the half of people dies of a heart disease or of a stroke at the brain, and every 4th person of cancer. So far, many people are living decades longer as this book is reaching into the future, and maybe more treatment is available. Although the exact nature and causes of all cancers are still uncertain, there are clues pointing towards the causes of special cancers. So the first thing here in the middle was cancer affects men and women equally. There are some types of cancers like breast cancer which are more affecting women, and other ones like lung cancer affecting more men, which would be in that case because men tend to smoke more. Family tendencies. Despite popular belief, cancer does not run in families and is not an inherited disease. However, there are predispositions which tend to run in families and which can bring on cancer. For example, in some families there is a tendency to a rare form of bowel polyps which can turn cancerous and which needs to be surgically treated as early as possible. There's also an incidence of lung cancer in families which smoke heavily. So we're saying now cancer is not hereditary. It is not hereditary passed on to the children, but there are from some types of cancers some tendencies that it develops more, like bowel polyps, which can turn cancerous. And I heard also something about breast cancer, which is also a bit more likely, but it's not written here, so maybe not. And also smoking, so also behavior could cause more cancer. And while we're already talking about that, I heard that many people in Australia develop skin cancer, so there would be also the environment where the people live. If the whole family is living in Australia where a lot of sun is. High risk occupation. These occupations, which include some chemical industries and mining and poor safety conditions, predispose people to skin, bladder and lung cancer. So also a risk is for some people who work with specific or with some chemical substances. Chemical causes. It is likely, but as yet unproven, that certain chemical properties in food, water or air can irritate some body cells and make them cancerous. The suspected danger lies in the excessive consumption of alcohol, eating raw food contaminated by a yet unsuspicious substance, the possible radioactive and chemical contamination of drinking water and air pollution in factories or at home, which is more likely to occur in cities than in country. So we're saying some things which were not proven in the 1980s, and I'm not sure. I think one or two, I don't want to go into specific because I just don't really know it. One or two are more in the opposite that they are not, but also some are more that they actually are suspicions. So these suspicions here, and as far as I know, some, I don't want to name them, have showed that they are more likely to actually cause cancer, and others have showed that they are not so likely to cause cancer. So it's naming here, for example, chemicals in the food, water or air. And then also drinking a lot of alcohol, and maybe raw food contaminated by a yet unsuspicious substance, then radioactive and chemical contamination of drinking water and air pollution in factories or in cities. Cigarette smoking. The medical world now agrees that there is a definite link between cigarette smoking and lung cancer. It is likely that the inhaled smoke from thousands of cigarettes over a period of 20 to 30 years, and some suspected that people will irritate the cells of bronchial tubes enough for them to turn cancerous. So we're saying here, cigarette smoking, the people are already in the 80s very sure that it will cause cancer, or makes it way more likely. Infections. In some cases, infection can cause cancer in animals. Some children in Central Africa suffer from a neck cancer caused by a virus, and there may be other cancer-causing viruses responsible for some forms of leukemia, and for cancer of the neck, of the womb, also of the cervix. However, cancer is not infectious. So cancer is not infectious. If one person has it, another person does not get it. This is not a medical advice. But that is what we're saying here very clearly. So what we said here is, there are some viruses, for example in Central Africa, there is in the 80s or 70s there is or was some which could cause neck cancer. But that is not the general thing that there is a virus causing it, at least as far as I know, and also a person is not infectious to another person. This is not a medical advice. But they're stating that you're very misunderstandable. Very That is again the word, misunderstandable. Misunderstandable would be the word. So we're stating it very clearly that cancer is not infectious to another person. Molds and warts. Most molds and warts are harmless, but some may change their shape and color and become cancerous. So here we're talking again about skin cancer or something, that some molds and warts are harmless, but some can then change and cause cancer. Or are cancer or something. And become cancerous and are cancer. Okay. That was the oncology part. If you were here for oncology, you can go directly to the next part. We're going to read the rest again and try, while I'm talking, let's try to memorize that all for our presentation. And then in one time we will do our presentation. If you were here for medicine, this was no medical advice. I just tried to try to understand it. If you stay here, participate in the standing in the tip time. It's better to be honest, and we have just 1 minute left. The feet are standing together, the arms are carved out of the toes. Out and down. Come always to the big toe. Out and over to the side, in and up, out to the other side, in and up. Make an inch space between the feet over to the side, in and up, out and down, in and up, out and to the other side, in and up, out and down, in and up, out, lean onto the knees. You can stay on tiptoes or not. Breathe in, Out, make a hill of the back. In middle of the belly. In middle of the belly. In middle of the belly. In middle and all the way around, back up to the top of the shoulder. Your feet are standing together, but even the arms up. Then out and down. Bend the right knee, stretch the left one. Change, stretch the right one. Middle. Breathe in and up again. Hands together. Down. Base pose for short tiptoe yoga. I thank you very much, and until next time.